This video will provide brief information on the infection tularemia, its drug of choice, and a possible drug carrier for the drug of choice. Tularemia is an infection caused by an intracellular bacterium called Francisella tularensis, and it's an infection that affects both humans and animals. Individuals who are mainly affected by this disease are butchers, hunters, farmers, and fur handlers, as they tend to come in contact with animals that are infected more frequently. The disease is a zoonotic disease, and it's transmitted through bites, inhalation, ingestion, or contact with infected animal. Its manifestation is through ulcers of the extremities, mouth, or eyes, and in severe cases, the pneumonic form can be contracted, which may be fatal if left untreated. There are drugs available for the treatment of tularemia, and they include antibiotics, and a list is provided here. And the drug of choice is streptomycin. Streptomycin is an aminoglycoside antibiotic that was introduced in 1944 that proved promising, as it has a broad spectrum of activity and its chance for resistance is slim. It works by binding to the 30S ribosomal subunit, causing the misreading of tRNA, leaving the bacteria unable to synthesize protein, which is important for its growth. Like other drugs of the class and many other drugs, there are toxicities associated with streptomycin, which include nephrotoxicity and ototoxicity, which are dose dependent. There are many drug carriers ranging from carbotubules to nanoparticles and liposomes and much more. Liposomes are spherical vesicles ranging from 30 nanometers to several micrometers, and they include one or more lipid bilayers that contain a hydrophilic head and a hydrophobic tail. In this region, the intracellular space, this is where hydrophilic drugs can be attached, like aminoglycosides. Aminoglycosides on their own are not effective in the treatment of intracellular infections, but once they are encapsulated into liposomes, their use can be beneficial. Liposomes on their own are accumulated by the MPS, which is a part of the immune system. This is one advantage of having aminoglycosides encapsulated inside them, as once they are administered, they can be accumulated into the lymph nodes, spleen, liver, and the lungs. The half-life of aminoglycosides tend to be prolonged once encapsulated into liposomes. Here I've provided some references that I've used to put together this presentation for your use. Thank you.